Hello, my name's Julian Balantannye. Now, something's for sure, this is strange times. We've all experienced some sort of hardship over the last few weeks and months. I'm delighted to say that my guest today is Dr. Ajay. Dr. Ajay, lovely to have you with us. I know you're not in the studio for several reasons, social distancing being one of those reasons, but tell me a little bit about yourself. What's your expertise?
So thank you for having me on the program. As you said, I'm Dr. T. Ayodele Ajay. I'm a consultant psychiatrist and I work in the NHS. But in addition to that, I do also write a column on mental health for a London newspaper, Testify newspaper. And I regularly write mental health columns on public mental health education in a number of publications.
Let me ask you the first question. What is the Every Mind Matters campaign, and more specifically, why is it focusing on children and young people?
That's a very, very timely question. The Every Mind Matters campaign, it's a public health England initiative in collaboration with the NHS and a number of leading mental health charities in the UK. And this is really to support parents and carers of young people at this time in order to equip them, to help them to support their children because of the mental difficulties that have been associated with the COVID-19 crisis. And this is particularly directed at young people and children. The reason being that research does show that in the recent times, young people have reported increasing levels of anxiety and difficulties with their mental health.
Sometimes I feel lost, said the boy.
The past few months have been hard on everyone, including our kids. Isn't it odd? We can only see our outsides, but nearly everything happens on the inside.
What is the bravest thing you've ever said? Asked the boy.
Help, said the horse.
Every Mind Matters will help you find what's right for your kids, with tips and advice to help you support your child's mental well-being during this time. Whether it's listening to them talk about the challenges they're facing or helping them develop skills to cope with their emotions, supporting your children's mental well-being can help them boost their mood, feel good about themselves, and be ready for life's challenges.
Sometimes I feel lost, said the boy.
Me too, said the mole. But we love you.
And love brings you home. Visit Every Mind Matters today.
Do you believe at the moment that young people are more vulnerable to the effects of COVID, as in from a mental health perspective? Or is it a case of we need to focus on each different demographic and care for each at a time?
I think everyone has been affected undoubtedly by the impact of COVID. But for young children, there is a peculiarity to their own condition because they are no longer able to socialize with their colleagues. At least they weren't able to do that in the way that they used to. They have also missed a lot of schoolwork, which means that there's quite a lot of catching up to do. They need to now return to a different normal. What used to be normal is no longer normal. So for them, it's a lot for a young mind and a young person to deal with. So that's why there is a focus on them. And it's not unusual that with all of these stresses, including the stress of loss, some of them have lost friends, some of them have lost family members. So all of this will put them at risk of mental difficulties.
So how does the campaign support parents and carers?
So the campaign is directed to parents of children between the ages of 5 and 18, and also children and young people between the ages of 13 and 18. And what it does is that it provides information. It's like a one-stop shop where your parents and young people can go to actually access information to help them to understand and identify the symptoms of mental illness and how to deal with those symptoms and where to get help.
And what do the new survey results show exactly?
So the survey results show that there is increasing level of anxiety among young people during this period. And in fact, 52% of parents and carers actually say that the top 3 worries that they have regarding COVID-19 has to do with the impact that this has on the mental health of their children. 23% of those parents actually say that in this period that their children have reported sleeping difficulties, and about 19% of those parents also say that their children have also behaved in an unusual way. So there's behavioral change, there's sleeping difficulties, and there's also anxiety.
I'm sure it must be a double whammy, if you excuse the expression, if a parent might be suffering the same anxieties and then still trying to care for a young person with similar anxieties. It must be a very troubling time.
Absolutely, and that's why the Every Mind Matters campaign also focuses on the parents and their care and the carers themselves. So in that campaign, on a website that I'll be quoting very shortly, people can actually go there and carry out what's called a mind plan quiz. A mind plan quiz would enable the parents themselves or the carers to answer a very short question. It's a very short survey. It's only 5 questions long. And when they answer those questions, it then generates for them a tailor-made mind plan such that they can address their own mental well-being. Because if you are not in a good state yourself, it's very difficult to support your children or your people in your care.
So remind us what signs that a child or a young person is actually experiencing mental health difficulties that we can look out for as parents, as carers, as grandparents?
That's a very good question, because that's half of the job done. In terms of the signs and symptoms to look out for will be the child expressing feelings of anxiety. Some children would actually say they are anxious. In addition to that, some children will go off their food, their appetite will be less. Some children, as I've said before, sleeping difficulties. Some of them will show concern about leaving the comfort of their home. They might not feel comfortable going to school or mixing, and this will lead to social withdrawal. They might be more irritable in mood. They might not want to interact with their friends on social media like they used to. And the thing to also remember is that every child is different. And the way that a child responds would actually be based on their age. It will be based on the way they've dealt with stress in the past, and also sometimes on the way they've seen their own parents respond to stress. So that's why it's important for parents also to be engaged in this process.
Now, what are some of the issues most prevalent in the Black community when it comes to mental health of young people? Is it a different focus, a different area, or is it all pretty much the same?
So that's a very interesting question, because there are 2 ways to answer it. One of them is that on the overall, we do know that children have been affected across the globe anyway by the impact of COVID-19. But then when we then look at the children or the young people in the Black ethnic minority backgrounds, we do know that the COVID-19 crisis disproportionately affected this population, this community. And so in addition to other mental health problems that we've highlighted, there are also issues of loss that those children might be dealing with, issues of bereavement. But we do also know that as a community, the Black ethnic minority community are not always forthcoming in terms of accessing mental help. And that's because of stigma. So the issue of stigma is one that could prevent these young people from accessing help. In addition to that, we also do know that there's been the Black Lives Matters incidents, and that's also brought up for young people in that community the issue of belonging and identity.
So what are the main tips and advice for parents and carers to support children and young people's mental well-being?
So the main tips to look out for, there are 5 of them, and they are very easy to remember. One of them is to be there to listen. It's very important for parents and carers to create an opportunity to listen to their children and to the people in their charge. The next point is to stay involved in their lives. Staying involved means being interested in the activities that these young people are interested in. So whatever whatever makes the young person buzz, the parent or the carer must be involved in that. And the third thing is to encourage positive routines. Positive routines will be in terms of very good bedtime routines, good appetite, and also physical exercise. So it's important for parents to stay involved, to encourage those, and to also model the things that you want the young children to do. And and the fourth thing will be to actually support them in engaging in activities that they enjoy, such as if it's drama, if it's music, if it's writing, whatever it is, the parent to support. And the final thing is to take them seriously. Let those young people know that whatever you say, you take it seriously. And that's by listening to them and helping them to talk through the challenges that they're having.
Finally, where can we go for more information?
Where to go for more information is everymindmatters.co.uk. The other websites will be www.nhs.uk/everymindmatters. And there's an hyphen between each of those three words, Every Mind Matters.
Can I just say, Dr. Jai, I've learnt so much, and I know you must be an extremely busy man at the moment. Thank you so much for your advice. Thank you so much for your continuing work and your support. Thank you.
Thank you for having me on the show.
I've been Julian Balantannye. Hopefully you've got more of an idea now where you can go. You've got the signs to look out for. And again, it's troubling times for everybody, but together, hopefully, we'll get through this. My name's Julian. I'll speak to you soon. Bye-bye.